Well, this fall, the COVID-19 pandemic became the deadliest disease event in American history, officially surpassing the Spanish flu of 1918.
Tonight, we're lining up these two pandemics end to end to see how our experiences today compare to their experiences back then. Amy Hocker joins us now with more on this. Amy?
Randy and Kelsey, when COVID-19 hit a year and a half ago, it was new to just about all of us. But it's not the first time Minnesotans have lived through a deadly pandemic. At the oldest cemetery in Minneapolis.
This is Lucien Solvet, also died, influenza, our baby.
Stories from the 1918 flu pandemic remain untold.
So we don't know much about Lucien.
He did have a relative who came, I would say, up until the last 10 years with the same name, Lucien.
We asked a cemetery historian, Sue Hunter-Weir, to walk us through some of those stories, specifically the Minnesotans here who died from the 1918 influenza, also known as the Spanish flu, to see what these voices from the past can teach us today. One of those stories belongs to night watchman Percy Gould. He and his wife Nellie were among the first Minnesotans to succumb to the flu in 1918. They died 10 days apart, leaving 3 children behind. 100 years later, we're still seeing families, young and old, torn apart by a similar viral threat.
There was a story in the Washington Post last week about a young couple in California who died within 2 weeks of each other, and they left 5 children behind.
A century's worth of proof that pandemic deaths aren't just about the here and now. The loss of loved ones will affect families for generations.
I think what people need to really remember that this pandemic is not an individual crisis. I mean, it certainly is for the person who dies, but it's more far-reaching than that the consequences ripple down.
It happened in Sue's own family when her grandmother Mary died of the flu, leaving Sue's mother behind.
I think it affected her whole life. She never really knew her mother. I think it disrupts family stories in really interesting ways.
The 1918 influenza pandemic is believed to have started in Kansas from soldiers fighting in World War I. According to the Minnesota Historical Society, Fort Snelling Hospital reported its first case in September of 1918. The timing was awful. Medical staff across the country was already stretched thin because of the war. Nurses were indispensable.
Often the sick and frightened children were bundled up and taken to the university hospital in paddy wagons.
Former Hennepin County History Center intern Hannah Dyson recently researched the story of nurse-in-training Pearl McIver. The 23-year-old was pulled to the front lines at the U of M hospital in 1918 when the pandemic hit. For weeks, she was the only one working the overnight shift in the pediatric ward. She wrote about it some 50 years later.
Rules of the hospital required all personnel, doctors, nurses, and maids, to wear masks, close-fitting caps, and white gowns, supposedly to prevent the staff from contracting influenza. Imagine the terror of these children to find themselves in a strange environment amongst a bunch of ghosts.
So Pearl took matters into her own hands, literally.
And so she decided that she would pick up the children out of their cribs and take them to the rocking chair and soothe them to sleep, kind of by just rocking them in a blanket. And that was not the guidance that she had from the hospital, because you really didn't pick up the children.
Pearl McIver put the lives of those children before her own, the same way today's frontline workers stepped up for all of us during the early months of COVID-19, with limited PPE and no vaccine. And then there's the balance between government authority and personal freedom. In 1918, the Minneapolis Health Commissioner, Dr. H.M. Guilford, rolled out some pretty heavy-handed restrictions. He banned public gatherings and shut down businesses and schools. People were confused and skeptical, especially because the rules were much more lax in neighboring St. Paul. At the same time, the equivalent of a super spreader event was breaking out in Minneapolis. The dorms at the U were full of young men training to become soldiers for the war and became a breeding ground for disease. 100 years later, we see the same hesitancy towards science, medicine, and mandates, and the same tendency to gather at any cost. In August of 2020, more than 400,000 people descended on South Dakota for the Sturgis motorcycle rally, feeling it was safe. Contact tracing afterward found at least 649 cases of COVID across the U.S. One Minnesotan died, 4 others were hospitalized.
In our wildest dreams, no one ever imagined that there would be a politicization of something as simple as wearing a cloth mask. Something as simple as that.
Rich Danila is Minnesota's deputy epidemiologist. He and his team have shaped Minnesota's public health protocols during COVID-19, things like masks, social distancing, and vaccines. And just like Dr. Guilford, they've had their share of critics.
It also never dawned on us that people would, not trust science in terms of the vaccination. If you or your loved one gets cancer, you go to the doctor, of course you want the best cancer treatment, the most modern treatment cure you could. And so it boggles our mind.
Politics aside, most people agree science is at the heart of stopping the spread of any pandemic. That said, it's never a perfect science.
I think we have a long way to go yet before, we can even see the light at the end of the tunnel for the pandemic.
The more we peel back these untold stories from our past, the more we see their relevance today. We may be separated by 100 years and modern medicine, but we are connected by our vulnerability. Theirs, a lack of medical treatment. Ours, a higher, more mobile population that's only going to grow bigger and more mobile. The question is, will the decision makers of the future find relevance in the untold stories of COVID-19?
Now, we mentioned off the top that COVID deaths have surpassed the Spanish flu, but we want to point out there is a caveat here. Simply put, about 100,000 more Americans have died from COVID than the 1918 flu. However, our population today is 3 times larger. So when you take a look at these deaths per capita, there were actually more deaths from the flu in 1918. Randy, Kelsey?
Getting those personal stories from the nurses in the hospitals in 1918, just captivating.
Yeah.
It does remind us how far we've come, but also how far we have not come.
The vulnerability
Right?
is still there. It's just in
Yeah.
different ways.
Okay.
Yeah.
Thanks, Amy.
Thanks, Amy.